Good evening, we are the Group 7 and I'm Wang Ruolan. Today we are going to discuss the impact of disinfectants for the kitchen to human health, and our presentation will be divided into 5 parts. First, introduction of disinfectants. Second, exposure pathways. Third, hazards and impacts. Fourth, case study. Fifth, mitigation methods. Here is my part, the introduction of disinfectants. Disinfectants, you can also say it's antimicrobial agents. They are used to destroy the microorganisms on non-living object surface. Here is the work mechanism, and these are 4 main types of disinfectants: bleach, disinfectant liquid, surface wipe, and floor cleaner. Here is the bleach. You can see the active ingredient of the bleach is sodium hypochlorite, and the kitchen used bleach generally packaged percent is 3 to 8. Hypochlorous will dioxide to clean the kitchen, and bleach will degrade the microbial protein and effectively kill the bacteria, fungi, and virus. Here is the virus. And this is the effective chlorine concentration. This is the disinfectant liquid. In the kitchen, we often use these 2 types: dishwashing detergent, hand washing liquid. One is to prevent foodborne illness, remove cooking utensils, dishes, and other items. Another is to clean hands. And the active ingredient of this liquid is surfactant, icobenzene sulfonates. The special structure makes oils then dispersed in the water and finally washed down. Now is surface wipe. It can remove stains from kitchen utensils such as gas stove, range hood, refrigerator, and microwave oven. Surface wipe can replace the reusable rags to reduce the bacterial growth, remove grease from the kitchen utensils, and contains a certain amount of natural bacteriostatic substances. Finally is the floor cleaner. Our kitchen floor is easily polluted by mud, dust, grease, fever, E. coli, and others. So it is very important to use this floor cleaner. Its ingredients contains surfactant, bactericide, fragrance, and other ingredients. It can remove stains and grease, kill bacteria and fungi, keep floor bright, and make it smell better.
Thank you, Yona. Now it's time for me to introduce the exposure pathways. What is the exposure pathway? The definition is that the exposure pathway is the route of a substance takes from its source to its endpoint, and how people can contact with it. Firstly, in order to identify potential exposure pathway, there is the relationship between sources, source areas, chemical of concern, transport mechanism, exposure routes, and receptor. Firstly, it is source. Our topic is focused in the disinfectant in the kitchen, so there are disinfectant liquid, bleach, surface webs, and floor cleaners. And then for the source areas, our topic is focused in the kitchen. For example, the kitchen water counter, kitchen utensil, flooring, sink, and cabinets. There is chemical of concern. For example, disinfectant liquid contain alcohol, oxidizing agents, QAC, phthalate, bleach contain ammonium, chlorine compounds, surface web contain chlorine compounds, alcohol, oxidizing agents, and floor cleaners contain phenolates, phthalates, and iodine compounds. Moreover, this is the transport mechanism. Our topic is focused in the kitchen, so there are accessible air, potable water, food, dust, work surface and tools, and also even the animals in the kitchen will be the transport mechanism. Next, it is the most important part in exposure pathways. It is exposure route. Exposure route include inhalation, which means the chemical through breathing into our body during use, and the user without the proper protective clothes, the chemical will through our breathing into our body. The potential hazards, for example, the breach flame can damage the lung, which in will release the hydrogen chloride into the air. And also exposure routes include ingestion. Ingestion means the chemical through eating or swallowing enter the body. For example, the parents store it in the non-original bottles. The children will mistaken for food and then cause them. The potential hazard will make them nausea, vomiting, or diarrhea. And the last one of exposure route is absorption. Absorption means the skin directly contact or the eye contact the chemicals. For example, the bleach can cause a chemical burn or irritation or drying your skin during you use directly contact the bleach. Lastly, it is the receptor of exposure pathways. In our case, the common receptor is children, elders, maid, and even pets. And there is two cases of the unintentional poisoning case. First one is in Hong Kong. The Center for Health Protection find that between 2011 and 2013, there are about 800 of these poisoning cases among the children aged under 14. And 70% cases is happening in the home. And we find that about 50% of the house product will cause poisoning agent to children, such as disinfectants. And this case is happened in the Brazil in 2008. The research find that there are over 90% of the children in unintentional poisoning caused by ingestion, uh, because they will easily to mistaken for food of the disinfectant because they are colorful. So I will pass the next part to Liu Xuan to talk more about the hazards and impacts. Thank you.
My teammates have introduced the usage of disinfectants and the exposure pathway. In my part, I will introduce the hazards and impacts of disinfectants using the status from 2 surveys. Please look at this page. This data comes from a survey which searched 50 cases of caustic injuries happening in a hospital. Researchers asked the injured person what kind of chemical hurt them and where they were hurt by this kind of chemical. We can easily find from the chart on the left that disinfectant is the main source of the hurt. And please look at the chart on the right. We can find most of cases occurs within the interior of the family home, with the kitchen being the common location. And we can easily come to the conclusion that kitchen is a dangerous place and disinfectants is a kind of dangerous chemical. In this survey, researchers also find the most common chemical is alkali, over 74%, and the second one is chlorine bleach, only 20%. The most frequently ingested alkalis were dishwashing powder, disinfectants, and caustic soda used for cleaning ovens and degreasers. That is why the injuries are often happens in kitchen. In this page, we can analyze the hazards rose through the status for another survey which analyzed 2,810 calls made to 2 poison controls in Brazil to study unintentional poison caused by household chemicals including disinfectants. Please look at the bigger chart. In this chart, we can find that ingestion accounted for 90.4% of all exposure, followed by inhalation 4.3%, skin contact 2.4%, and eye contact 2%. And then please look at the smaller one. In this chart, we can come to the conclusion that children are sensitive population because children under the age of 5 were exposed by almost all routes, over 71%. When people get hurt by disinfectants, the most common symptom reported was sneezing, headaches, watering of eyes, skin rash, and cold cough. Become more serious, the ALI and ARDS are also very common. The most frequent outcome among the cases of poisoning are acute. On the right is why people will be hurt by chlorine. Even chlorine is very smelly odor. Because when in low concentration, the smell is not a symbol. People will not take care of it. When the concentration becomes higher, people's adoption rise also. People usually find this kind of odors after they have been hurt by this kind of odor. And what are the risk factors? The most common one are adults within reach. Children and elder people may mistake the disinfectants or total it over. People will have higher risk of suffering hazards. The second one is storage in non-original bottle. Some people will store the disinfectants into a new bottle to save the space. When people use it the next time, people may use it incorrectly without specification. Without proper labeling, people, especially the children and elder, may mistaken it or get hurt by touching. During use, irritating gas and corrosive liquids will hurt people's lungs and skin. And incorrect use, the dogs and personal protective equipment should be taken care of when using some disinfectants. The possibility of exposure will increase. Kitchen utensils, mixture of products, misyaken for food and medicines are also the risk factors, but they are seldom to happen, so we will not introduce them in details in this part.
Now I want to share our case study section. Reports of poisoning caused by misuse of disinfectants are really commonplace around the world. According to the British Daily Mail, a mother who loves housework accidentally produced chlorine when she wiped the floor of the kitchen and was rushed to the hospital. This mother mixed the bleach and Dettol antiseptic into the mop bucket. Soon after, she began to have chest pain. The doctor said that if her son didn't take her to the hospital immediately, the situation could be really critical. In fact, the active ingredient in bleach is sodium hypochlorite. When it is mixed with the active ingredient hydrochloric acid in the antiseptic, the two compounds undergo redox reactions to form sodium chloride, water, and chlorine. Chlorine is a highly toxic gas with a strong pungent odor at normal temperature and pressure. When people inhale different concentrations of chlorine, patients will show different clinical symptoms. According to the information provided by International Chemical Safety Program, when people inhale a relatively low concentrations of chlorine, the mucous membranes and upper respiratory tract are irritated to varying degrees. When the inhalation concentration reaches 30 ppm, chest pain and vomiting will occur immediately. If the inhalation concentration is 40 to 60 ppm, the patient may have toxic pneumonitis and pulmonary edema. When the inhalation concentration is above 430 ppm, the patient will die. So do not mix bleach with antiseptic. And before doing housework, be sure to read the label on the cleaning product carefully. For disinfectant poisoning, different people will show different clinical symptoms. Generally speaking, the elderly and infants are more likely to misread or misunderstand the labels on the cleaning products and even eat them. According to the report of Associated Press in 2014, in 2 years, more than 700 American children were admitted to hospital due to the accidental mistaken of candy-like laundry detergent. Apart from that, beverage-like detergent may also cause ingestion, resulting in poisoning. In addition, pregnant women, the elderly, infants, children, and sick people have less efficient defense mechanisms and weaker immune systems. So when these sensitive subpopulations are poisoned, they usually show more seriously clinical symptoms. According to the report of Poisoning Watching Volume 1, issued by the Hong Kong Department of Health in 2008, between 2006 to 2007, 14 children under the age of 10 were poisoned by the accidental contact to bleach. The bleach contains sodium hypochlorite. If children swallow bleach, they will have symptoms of vomiting and gastrointestinal discomfort. If children inhale bleach, they may have lung complications.
Now, in the last part, I would like to share something about the mitigation methods in kitchen disinfectants. I will divide the measures into 4 parts. All of them are really relevant to our daily life. The first one is the individual part. As you mentioned above, most of the disinfectant contain lots of toxin agents, like the phthalates, which are really harmful to our health. The first suggestion is that using the natural disinfectants like the white vinegar, lemon, and essential oil. White vinegar is very common, however, it is power cleaner. It can easily cutting through grease and removing mildew, odor, stains, and residue out. Phase 2 is high acidity. It reduces surface bacteria. It is very good to replace bleach. Moreover, it is suitable material such as the spray bottle, microfiber cloths, and rubber gloves are indeed when we do the cleaning. They can protect our skin too. Due to the toxic chemical, it is important for us to use the disinfectant suitable. Some people think use several types of disinfectant can enhance the cleaning ability, but this behavior is very dangerous. It's easy to produce chlorine. So when we're using them, ensure use 1 ton of the cleaner 1 time. Keep the ventilation and remove the residue disinfectant after cleaning. Moreover, pay attention to the storage. The picture gives out a method to produce the man-made cleaner based on the vinegar. The storage is an important part, especially for the family with children and animals. It suggests that to store the disinfectant in the bottom cabinet without any food product, using the child-proof floor to prevent children touch them. If the volume is too big, maybe it's good for us to divide them into small size. Then is a suggestion about the producer and the third-party detection. For the producer, maybe create some neutral cleaner and a special label will help a lot for the health. Moreover, third-party detection have the duty to control the quality. Coming to the community, the first thing is to promote education and establish the database, telling citizens which disinfectant meet the stranger or which one is due to the family with baby. Adding to this, the labeling of the disinfectant also is very important. Here are some examples about the label on the disinfectant product. We can see most of them contain the active ingredient, some suggestions on the multiples used in the first ad. However, we cannot see any hazard pictograms directly, and the part of treatment information and the detailed ingredients are not clear enough. As a result, maybe it would be better for relevant department to contain the third-party logo, direction for use, and a clearly symbol in the label. Here are some of the references. To conclude, our topic is to discuss the impact of the disinfectant in the kitchen, and we also stress some mitigation methods about it. That's all our presentation. Thank you.